I'm going to say something, well, what I've been asked to say something about is talk about other industries. So unlike anything else you're going to have heard yesterday or today, I'm going to say very little about health. I'm going to talk about some lessons from the other regulated industries and competition in them that we know about in the UK. You'll see the Frontier symbol up there. When I was first asked to do this, I was working at Frontier with Matthew. I'm now at the Institute for Fiscal Studies. So what I want to do is look at, really ask you to think about the extent to which healthcare really is unique and think about what might be learnable from other experience. Matthew will talk more specifically about some of the applications to healthcare. Now, it's very easy for us all to think that health is just different from everything else, and of course in some ways it is. It's very big. I mean, even a former Treasury official thinks 125 billion is quite a lot of money. It's very complex, obviously. It's very prominent. But so are lots of other things that we have competition and regulation in. And we have very complex regulation and very effective regulation in energy and telecoms and a whole range of other areas where, over the next several years, we are looking at tens of billions of pounds worth of investment. So 125 billion a year is possibly bigger than any of these individually, but they're not little either. And we've got a lot to learn from what's happened over the last several years. So it's used in all economic regulation, which is what we're going to be seeing a lot more of in the health sector, is used in all the former public utilities, all of which we used to think of as straightforward public sector organisations. In electricity, it's largely in the private sector now, though a bit of nuclear still public. Water in the private sector, but not entirely for profit. Rail, I can say this now, it's sort of in the private sector, but in many ways not really. Post is in the public sector. So we've got a range of economic regulation in the public and the private sector with a range of different models. The regulation tends to be focused on the natural monopoly elements of this. So in gas and water and rail, there are networks which are natural monopolies. Less obvious in health where the natural monopolies lie. There are clearly reasons why you might just want one provider for clinical reasons. It may be that in certain areas there are natural monopolies. There may be economies of scope, but there are issues there to think about. In these areas, in these other regulated utilities, where there is less of a natural monopoly, then there tends to be a lighter touch regulation. I'm not going to talk about other forms of regulation, though they're also important. So, for example, the Financial Services Authority regulating financial services, and I'm not thinking about the banks here, I'm thinking about retail financial services. A lot of the issues they face in terms of the asymmetry of information between provider and customer are actually surprisingly similar, I think, to some of the things that we see in health. So what are the issues that we've faced over the last 20 or 30 years of experience in regulating these areas and introducing competition into them? Well, I'm going to say quite a lot about information as we go forward. You've already heard a lot about balancing cost and quality, but actually that is absolutely what underlies a lot of the economic regulation in a lot of these other sectors. What's the appropriate price for electricity, given that we really don't want the lights to go off? What's the appropriate price for water, given the quality that we need to achieve? How does price regulation fit into that? And then there are different forms of competition. In terms of the sectors I've just mentioned, in many of these areas, this is competition in the market between different electricity generators, for example, but also for the market. Rail franchises, the government effectively tenders for those franchises. And again, you can think of very similar issues in health where there will be competition in the market between trusts and hospitals and for the market when contracting and tendering services. Again, when you start to look at this, there are many similarities, I think, between what we've seen before. So, I didn't say at the beginning, there is a paper which accompanies this. This is a very high-level exposition. The paper will be published by the Nuffield Trust later in the spring. So let's think a little bit about some of these more specific issues. An important issue in all of these areas, as I said, is ensuring quality. What are the right metrics for measuring that. In some areas it's about measuring customer service, how quick the phones are picked up. In some areas it's about, as I say, making sure the lights stay on, making sure the water reaches an adequate level of quality. Different ways of achieving this through the system, through measuring physical attributes of the service, through measuring customer response. Competition regulation is, of course, crucial across this piece. Actually, a lot of the competition regulation in terms of horizontal mergers, competition between different electricity generators or telecoms providers, is really very much the same model that the Competition Commission uses across the whole of the economy, looking at the scale of the relevant market, the dominance in the market. Again, this reads across quite straightforwardly in many ways to healthcare, with the one significant difference, of course, that this is not a market in which the ultimate consumer is making the payment. But one can move a lot of that analysis fairly directly across. Vertical mergers in the regulated industries are a bit different to those in much of the rest of the economy, because the danger that you have with vertical mergers is that you lose some of the competition that's available in parts of these markets, because there are the natural monopolies in other parts, and that tends to be more carefully regulated, as it were, in many of these areas. And again, you can see, I hope, very clear parallels with how we might think about competition regulation in health. And finally, price regulation. Where do we have it and when is it needed? It's essentially associated with the degree of competition. In those areas where there is significant competition, price regulation has actually been either never introduced or phased out. It's very much focused on price caps rather than rate of return regulation. So what the price cap achieves is a real incentive for efficiency. If you have what I mean by rate of return, price regulation is that if you have £1 billion of assets and you're allowed 5% return, then the price is set according to that. But of course, that takes away most incentive for efficiency and therefore is not generally used in the UK. And again, the issues around how we use prices as caps in the NHS is crucial. Across all of this, and again, I think this is something that we'll be seeing, I mean, you will already have seen as an issue in thinking about how to introduce competition and regulation in the health service, is to do with the fundamental regulatory challenge of asymmetry of information. Now, were it the case that regulator and regulated saw all of this stuff and saw the same numbers and understood the same numbers, it would be difficult enough. But actually, the world we're in is that the regulated tend to have a significant informational advantage over the regulator. And the complexity in some of these areas, and again in health, is a large part of that. So I'm going to finish off my bit before Matthew goes on to talk about stuff that you may feel is more directly relevant, by talking about some of these issues in the asymmetry of information. How in the regulatory systems have we overcome or begun to overcome some of these issues in asymmetry? Well, the first and obvious one, in a sense, is expert advice, your experts versus mine, and this keeps some consultancies like Frontier in business. Both from a sort of engineering point of view, what do the regulators' experts believe is the right expected cost? What do the regulated industries think? Cost modelling. If you're thinking about telecoms, how do we know how much it's going to cost to provide services in rural areas? Well, we can work out the cost of copper wire and the number of people it takes to put it in and how much they're paid, a range of things like that. And that is literally the way that some of this information is put together. Financial incentives. Actually, having price caps provides financial incentives, or can provide financial incentives, to reveal information. Menu regulation, I've called it. Actually, you can put incentives in the system to provide for the regulated industries to reveal the correct information, because if ex post they are shown to reveal the information correctly, you reward them more than you would have done if they tried to claim that things are going to be more expensive than they actually turn out. And that's used significantly and increasingly in the electricity and water sectors. And then in terms of quality, actually you can find people, you can provide them with incentives to provide appropriate information and the quality that you're looking for. And finally, benchmarking. This is one of the reasons it's terribly important in a lot of these sectors to have more than one provider beyond the standard competition issues, and this is something that some of the Competition Commission actually takes into account in addition to normal competitive issues, that actually you need enough water companies or electricity companies to benchmark against each other to actually know how effective, to help the regulator make sure that competition continues to be effective. So there's a fundamental set of issues there, which again, there are obvious parallels with what we'll be thinking about providing and creating in the health sector. I put at the bottom rigorous pragmatism. I've talked somewhat theoretically about what happens in these different sectors. It develops over time. The way that the electricity market is being regulated is going to change quite significantly over the next several years, because the electricity market is changing in the face of climate change, in the face of more distributed generation than we've had historically. The way in which you regulate these sectors, exactly as we just heard, markets change, the way in which you regulate them need to change. But on a final note, I'll just say, before Matthew takes us through a little bit more how this applies to healthcare, the UK has been a leader in introducing regulation and competition in these areas. 30 years ago, it would have looked as daunting and surprising, and I remember it just, in electricity and telecoms and so on, to be introducing this kind of level of regulation. It's been done, and I think broadly it's been pretty successful. The questions are, how can we use that success and the information that we gained from that to help us do the same in healthcare?